What are the side effects of sickle cell stem cell transplant conditioning? Imagine preparing your body for a new beginning, but that process involves some significant changes. When doctors perform a stem cell transplant for sickle cell disease, they use conditioning treatments to make space for the new stem cells. These treatments often include chemotherapy, immunosuppressive drugs, and sometimes low-dose radiation. The goal is to suppress the immune system so it won't reject the donor cells and to clear out the bone marrow. But these preparations come with side effects that need careful management. One of the most common issues is an increased risk of infection. Since conditioning suppresses the immune system, patients become more vulnerable to bacteria, viruses, and fungi. This makes infections more likely during and shortly after treatment. Blood cell counts also drop because the chemotherapy and radiation destroy bone marrow cells. This leads to anemia, which causes fatigue and weakness, low platelets that increase bleeding risk, and low white blood cells, which further raise infection chances. Graft-versus-host disease is another concern, though it is less common in sickle cell transplants than in other conditions. It happens when the donor immune cells attack the recipient's tissues, which can range from mild skin rashes to severe organ damage. Organ toxicity is also possible, as the drugs and radiation can harm organs like the liver, heart, lungs, and kidneys. For example, liver complications such as sinusoidal obstructive syndrome can develop. Mucositis, or sores in the mouth and throat, is frequent and can cause pain and make eating or drinking difficult. Gastrointestinal symptoms like nausea, vomiting, diarrhea, and loss of appetite are also common during conditioning. Hair loss is typically temporary, caused by the chemotherapy, and fatigue is widespread due to anemia, infection risk, and overall treatment stress. Long-term risks include a small chance of developing secondary cancers later in life. There is also potential for chronic lung or heart problems resulting from the conditioning therapy. It's important to note that the conditioning regimens used for sickle cell disease are usually less intense than those for cancer treatments. This approach aims to reduce toxicity while still allowing the donor cells to engraft successfully. Patients with existing organ damage from sickle cell disease, such as liver or heart issues, may face higher risks during conditioning and transplant. While stem cell transplants can potentially cure sickle cell disease, they may not reverse all the damage caused by the disease itself. That's why close monitoring and supportive care are essential throughout the process. Medical teams work to prevent infections, support blood counts with transfusions, and manage symptoms like nausea or mouth sores. In summary, the side effects of sickle cell stem cell transplant conditioning include immune suppression leading to infection risk, low blood counts causing anemia and bleeding, graft-versus-host disease, organ toxicity, mouth sores, gastrointestinal discomfort, hair loss, fatigue, and possible long-term health issues. These risks highlight the importance of experienced medical teams guiding each step to maximize benefits and minimize harm. Always consult healthcare professionals for personalized advice, as individual experiences can vary widely.